Hi, my name is Dr. Tori Hudson. I'm a naturopathic physician. We're going to talk a little bit about ear infections today. You know, these are so common for young children and especially those, first few years of life. And one of the things that you might really want to think about is the benefits of breastfeeding. And breastfeeding for at least those first 6 months full on, and try to continue longer if you and the baby can. This really helps establish an optimal immune system for that baby and for your child. So don't be afraid, don't be ashamed. Breastfeeding is good for babies, it's good for the world, and it's good for their immune system. And it can help them from getting infections, including ear infections. Also, when babies are introduced to food and children start eating more foods, there's some foods that they might be allergic to or sensitive to. And there's some sort of classic offenders. Dairy foods are classic offenders. Cow's milk products in particular, classic offenders. Possibly wheat is a classic offender. Peanuts. These are things that can manifest both as ear infections and skin diseases and digestive problems in particular. One of the problems we run into is this tiny little eustachian tube. So this is where we want to have this sort of low inflammatory diet, which is less cow's milk, less wheat, less to no sugar, things that can create inflammation, and that can create a problem for that eustachian tube and therefore these infections. Some things that you can do on the spot is a little nasal irrigation with some saline solution. There's some old-fashioned remedies like warm baked potato in the ear or hot packs in the ear if they're starting to get a little fussy. There's some fabulous homeopathic medicines. Some of these are combinations and some of them are individual. Homeopathic chamomile, homeopathic belladonna, but these are things that you might need some help with understanding which one might be best for your child. There's some drops, some herbal drops, some mullein oil drops, some garlic and mullein and St. John's wort mixed together drops. These are things to do right in the ear, a little bit warm, couple drops in the ear each day for a few days. Helps decrease the inflammation, decrease the infection. Probiotics, again, can be helpful in preventing infections, maybe not so much treatment. So one of the things that's been done over the last couple decades is overusing antibiotics to treat infections, including ear infections. And it's really important to just kind of maybe put the pause button on antibiotics for an ear infection. And if you get a prescription from your doctor, ask the doctor, what are the clear guidelines for when I might really start? And could I wait 24 hours before I start? So if that would make you feel comfortable, that would be kind of optimal, because that 24 hours, chances are you could do some things to reduce the inflammation, reduce the congestion, and provide comfort such that you wouldn't need for them to take the antibiotics. Some things that we do saline washes, we do to decrease as a decongestant. There's quercetin and vitamin C and nettles. All these things reduce congestion, reduce inflammation. There are the homeopathic belladonna, homeopathic chamomile, other homeopathic medicines that are very specific for ear infections. If they have a fever, if they're behaving in a certain way, you can get some help to help steer you towards which homeopathic over another. If you are in a position after those 24 hours to then prescribe an antibiotic because your child is just feeling too ill, the pain is getting worse, the fever is getting worse, then it's important to take the antibiotics as prescribed by the doctor till the end of the prescription. And it's important to take probiotics, these lactobacilli species, to help restore normal immunity and help not have a cascade of other problems in their gut and their bladder and their overall immune system. You can kind of prevent the downside of antibiotics and support the upside. And you can use both, and you should use both the antibiotic and the probiotic together. And then I like to, when the antibiotic is done, I would continue that probiotic for at least a full month so that you really establish that restoration of the normal ecology of their mouth, their stomach, their gut, their bladder, and if they have a vagina, their vagina too. So that's a little bit of tidbit on how to use antibiotics a little bit more wisely if you're in the position to do so. But keep in mind these natural medicines and keep in mind the prevention aspect too. Thank you.